Folks, welcome back to another episode of the GPH podcast. Today, I'm joined with two incredible students and, frankly, leaders here at GPH. We have Nene Uwaomah and Haya Srour. Both of these students are graduating this semester at the time of recording this video with a master's in public health here at GPH. They both played a key role in the Applied Global Public Health Initiative, which a lot of you might know as AGPHI, AGPHI. There's many ways to call it, but this is an organization, for those of you that don't know, that has had significant community and a lot of strides that has taken place here at GPH. They have led cross-cultural research-supported capacity-building efforts and helped shape impactful global research projects, not only in New York, but also around the world in the Middle East, North America region, and even countries like Zambia. They bring sharp insights, on-the-ground experience, and a commitment to applied community-driven public health. And I can't wait to talk to both of them and hear about their journeys. Nene and Haya, welcome to the GPH podcast.
Thank you for having us.
Thank you. We're very excited to be here.
I'd love to kick it off because usually I do an intro and introduce who both of you are, what's your degree. And I took a step back from that today.
Yeah.
I'd love to hear from both of you. Where did your public health interest spark? How did you even get started into this world?
Yeah, for sure. For me, I would say that my public health interest really started in undergrad. I went straight from undergrad to grad school. So I was pre-med originally, and I had a lot of clinical backgrounds, and it was very patient-centered and individualized, and I thought that there just had to be more to it, although that is great to be a part of that. I wanted to broaden my perspective, and so I talked to my advisor, and he introduced me to community health, and that's what my undergrad degree is in. And I also had the opportunity to work with a PhD student at the time and work on her dissertation, and it was with endometriosis in women of color and lack of delay in diagnosis and medical racism. And I was like, there has to be a way to circumvent this, to overcome it. And it made me just want to go deeper into public health and pursue a master's.
Community-driven?
Community-driven, yeah, in a way. Definitely through experiences. I think you always have to talk to people and understand what their experiences is, and through that you can build up and try to create policies and just to be more logical in regards to the treatment that they receive.
And then how did that influence you coming over here then? Like, was that a big part of it? Was it just a collection of things and GPH fulfilled that?
Yeah, it was a collection of things. I'm also from New Jersey originally, so I wanted to be close to my family because I went to school undergrad in Virginia. So I was like, why not come closer to home? And then, of course, it's New York. And there's so many opportunities here, and it's a beautiful city, and it's very diverse. I think that's what I was really looking for, diversity, of course. And then when I looked at GPH and saw the concentrations and heard some of the people talk about their experiences here, I was like, it seems like a pretty good fit. And yeah.
I love that story. Well, welcome. Glad to have you here. I know you're almost graduating.
Yeah.
But so awesome to hear that journey. What about you, Haya?
I'll start off, I always love hearing people's public health journey. And my journey started off when I was a registered dietitian in undergrad in Lebanon at the time. And I was working in the hospital. And then basically I was working at a time where it was during the economic crisis and the blast. And so many things were going on, COVID. So when I'd go work with patients, a lot of the times their issues were not health related, and they were more towards social determinants of health, or just even being able to afford the consultations. I've had a patient actually tell me and the doctor if we can leave, although they were going through something kind of urgent, because they could not afford it. And then that kind of pushed me away from, of course, pushed me away towards voluntary work. And then that's when I started working with them. And I realized I was missing a lot of tools, specifically whether it's related to epidemiology or management or any of the courses that they actually offered at GPH. And then I found out what public health was, found out about the program, and then came to be able to learn those tools so I can apply them in real life.
Explain the social determinants of health in the Lebanon setting. So how would you describe that? If you could simplify it for us.
So social determinants of health are basically other things than your physical, biological needs and health issues. So it could be anything from education to income or socioeconomic status. So a lot of the people were struggling. There was a big gap between the levels of income And that was affecting whether people were able to get the care that they needed, and only a certain part of the population was getting the care that they needed, plus the education, plus their housing, plus so many other things, their food, that were leading to worse outcomes when it came to their health, and even avoiding getting health or primary health care, and it leading to be a more detrimental issue rather than being able to get it at the root cause.
So you went through a very practical experience, and I even am sad to call it practical, but a really tough time that influenced your public health journey and got you here to look at GPH or from a more holistic approach. Because you had the global in your public health as well. You were doing it in a different country at the time.
Yeah, and I think it was very interesting because at the time I was not aware that this was an entire field. In the US, it's very, there are a lot of universities that are offering it as a master's, as a major. So I think coming here and being able to see that all the different ways that they look at it, and being able to kind of know that when I go back, I can be more prepared in different places that I go to. But yeah, that's why it has a very soft space for me. Yeah. Just seeing all these people kind of struggle with things that I want to be able to help.
You both have mentioned something that I'm interested in exploring your work more, because you both have explained how you started. Seems very community driven, people driven, where you started. So what are some things that people can, because now we think that if I'm coming to GPH, it's a classroom setting, I'm going to take a lot of classes. But it seems like field work has what's influenced your decision to come here. So can you tell me a little bit about the work and how it collaborates with the classroom for both of you?
I think that fieldwork is really the epitome of what we do in public health at the end of the day. Again, serving the communities, going into them, asking them what it is that they need and what differences that they want to see, rather than us coming in and trying to develop interventions that aren't even practical for them at that moment in time. I think a lot of the work that we've done has been in the Applied Global Public Initiative in the lab. And we've had the opportunity to do different projects, whether it be in the MENA region or just recently we did a vaccination module targeted at adolescent and youth via PAHO, which is a branch of the WHO or the World Health Organization, for those who don't know, that's based in Latin America and the Caribbean. And the modules were really to circumvent misinformation and to increase health literacy amongst the youth, for them to overcome vaccine hesitancy, as well as to really just be strong in the information that they receive, and to have the education and the knowledge to just use the tools that we've given them.
Can you tell me about your work in Zambia?
Yeah, so my work in Zambia was actually from my APE, so my applied practicum, and it was via CMMB, also known as the Catholic Medical Mission Board. It was amazing, and I genuinely really, really enjoyed it. It was early ANC uptake, so antenatal care for pregnant women, trying to incentivize them to get early care to reduce any maternal mortality or issues with pregnancy. We worked with Access to Health Zambia, which is an organization over in Zambia in the Mwandi district, which is in the western province of Zambia. I did a lot of surveys and toolkits for the community health workers. Then once we received the data, we had to implement it from raw data to clean data for them to develop policies.
What does that mean?
So raw data is the numbers that you receive after a survey, the messy numbers that come. And when you clean it up, you just organize it into categories, whether that be, again, socioeconomic status, as we discussed, or where they live or how old they are, depending on what the question is. And you kind of get a well-rounded number, which you can then use for percentages or just to get a more specific number of the population, or specifically where. After that, also developed a literature review.
So GPH helped you get that opportunity as well? Was that a part of it?
GPH in a way. So via the lab, actually, Marcia Ortega, she's well known at CMMB, but also in the lab. She visits a lot, she guest speaks a lot, and CMMB is always looking for volunteers. So that was an opportunity. She connected me to Dr. Claudia Linton, who was my supervisor, who was very kind and very informative, gave great guidance. And I just had one of the greatest experiences.
How lovely.
Yeah,
okay.
thank you.
We've heard the Zambia side of things, and Nene's entire journey. What about you, Haya? What is your global experience? How does that come in? Where does it take you? How does it apply to the classroom for you?
Yeah, I think one thing that's very important that we learn a lot of times through fieldwork or experience is sometimes you might approach something and think the answer is so obvious to you or it's so obvious to the community, and then you might go in and then hear something very different. So I think aside from everything that we learn, we should also, one thing that's a very important skill is listening and being able, because a lot of the times you might go in with a solution, but actually when you listen to people, they might give you the solution. And one of my professors actually said this thing about how when you're approaching an issue, fall in love with the problem, not the solution. Because when you fall in love with the solution, then you might keep trying to push it and alter it in a way that you've put in so much time and money and effort into it that you want it to work for this community. But rather than going in that approach, just taking a step back and looking, seeing the problem, where is it coming from, what's the root cause, and then using the tools that you learn in class to develop a program or a solution, but just not starting off with that. And globally, I did work in Lebanon, as I mentioned briefly, but also I was able to work with UNICEF over the summer, and it continued for a few months as well as a junior consultant in their Learning Passport program. And I think for me, a big passion is accessibility, whether it's towards education or even medical supplies, and that's something that we also worked with in the lab. But just being able to provide that. And when I was working with them, we did work with Nigeria. We worked with many different countries across the world, because this Learning Passport program is basically global education, and they contextualize it to different countries. And then when we were working with them, we worked with Sierra Leone and Nigeria at the time and their Ministry of Education. And one of them was very, very easily approachable with the program, and they were very ready, and because we were helping change some of the website and the program. But then the others wanted more of an example first, so they actually waited until we were able to finish our work with the first country in order to be able to start working with them. So I think trust is also very, very important. You might think that, oh, this is a great idea, I think they would love it, but then they're scared because you're not only working with one or two people, you're working with an entire community, and that sometimes takes a lot of energy and trust to build that relationship so that you can work with them and they can let you help them.
I got some community leaders on this episode, huh? So, Haya, how did you land that? How did you end up working with them?
Yeah, so basically, similarly with lab, one of our faculty, Dr. Dicky, actually mentioned the internship for us, and then the person who was my basically manager at UNICEF interviewed me and a couple of people, and then it just thankfully ended up working out, and it was an amazing experience.
I love that you mentioned fall in love with the problem, not the solution. I think that's going to become a clip later on. That's really cool. The idea of how do we solve this, how do we solve this, rather than understanding the core of what's going on. So I'm sure there's a lot of problems you both fall in love with on a regular basis. So this is not so much of a problem, but I'd love to hear about the AGPHI organization. For those of us that don't know, what is this organization at school? How would either of you describe it?
So I think, so we've been with the organization for the past 2 years, and we started off as research associate roles, and then we developed team leads, and then we were able to become on the executive board as like director, project manager. And basically this goes to show that it's a very opportunity based like area where you can grow a lot. It's the Applied Global Public Health Initiative, and it's a student-led initiative that is also guided by faculty such as Dr. Dicky and Kira Block. And basically from there we work on 9 different projects, and it usually is a project that aligns with your interests. So there's related to climate change and malnutrition, there's communicable diseases, there's non-communicable diseases, there's also a medical supply chain project, there's related to vaccination modules, as Nene has mentioned. And yeah, and we've actually created a new project called the MENA project, and which works when healthcare works resilience, works on. We actually created a project this year when I first joined the lab. Not to go on a tangent, but when I was beginning with the lab, we were working on so many different projects this year, and then I realized there was a bit of maybe a gap in the area that I wanted to also contribute to, which was the Middle East and North Africa area, and then was able to create a project, connect with them, and then with an organization there, and then we were able to create public health modules for first-line healthcare workers or in general. And then I think that was something that meant a lot to me, to be able to kind of give people some of the tools that I've learned here, that we've learned at GPH, and being able to work with communities that maybe did not have the access and just share that knowledge with them. So I think that also goes to show that this lab is, you are able to create your own projects, you're able to work with a lot of different organizations. So I think it was a really great experience in that sense.
The way you're describing it, though, it feels like I'm a student. I walk into this organization and there's so many projects to choose from. Is that the case? Plus, I can create it? Is it something like that?
I think to an extent, honestly, but of course there's guidelines, there's ways to approach it. When you first join, I think you have an interest form that you sign up for, and then based on your skills and based on the spaces, sometimes you might have 5 positions available in a project, and sometimes you might have none. So you can fill out your interest, and then basically the e-board, like, we choose where the person kind of is most fit. And then with time, you apply for like team lead roles, you apply for e-board roles, and then you're able to also reach out to Dr. Dicky and Kira. They're very receptive and are interested in students' ideas for projects. So if there's capacity and there's people available, then you're able to start a new project. It just takes some time.
It does. Yeah, we like to align as well, applicants with whatever skill set that they have, and see how we can translate that into the projects that we need to be filled up. And like Haya said, it's a very applied lab. So a lot of the work that we do is very real world experience. Again, like we said, we worked in Lebanon, we work in Ethiopia, we work in the Paha region. We work very globally, internationally, and we really try to use all the theoretical work that we developed here at GPH and try to apply in a real world experience. And I think it's definitely a great starter when we go into the real world and we start to look for our jobs and everything. And I think it gives us a solid foundation to build off of. A lot of the work that we do it's a little difficult at times, and there's communication issues and a lot of conflict resolution that we develop. And I think it's just one of the greatest parts of being at GPH for both of us. Yeah.
What skills have you gained being at the organization?
Skills that I've gained being at the organization. Well, I've been a project manager for a full year now. And project management is a lot more vast than what I originally thought I was taking on. Not only are you managing multiple projects at one time and seeing what their needs are and being an external resource, but you have to be very innovative. You have to understand how to solve issues that 3 or 4 people already tried to solve, and now you have to come up with a new idea, and you have to be very timely, and you have to communicate again with external organizations in different countries, and keep in mind obviously competency and cultural respect, but also trying to navigate timelines and deliverables. It can be overwhelming, but at the end of the day, we are a team and we do have a common goal. And it's really just to improve all the skills of the students in the AGPHI lab, as well as meet the needs of the organizations that we serve.
Seems like what life is outside of school, really, but you're recreating that inside of school.
Yeah.
Because you've mentioned at least 7 things right now that all apply to someone's skill set when they go out and do their own projects that organizations outside of GPH maybe.
Of course, yeah, definitely. And I think that's the very applied part of the Applied Global Public Health Initiative, and something that Dr. Dickey does stress. And I think that he has done a great job of just ensuring that we are professionally ready, and that these are skills that real people in the real world do have. And it's something that we've been able to really embrace.
Speaking of embracing, when both of you came in, I felt like two besties walked into this place. And I truly mean that. And it seems like this organization of AGPHI is where both of you have found a sense of community, friendship, I would say a sense of family, really. So Haya, you feel it's the same for you? Has that organization meant a sense of community for you?
I think, just starting off this year, and this would actually be when we're talking about skills and stuff like that. I think just being able to connect also and just listen to so many people is when I took on the role for like example director, and I was trying to be there for so many people at the same time, but also just they were there for me as well, because it just became a community within. And I was just so happy to be able to work with so many people. And even the team that we have, the leadership team, we have our weekly meetings. We have our weekly meetings with faculty. So I think just meeting with someone on a weekly basis, and they're good people, you naturally click and I think that's what makes work much more successful, just the relationships that you have. And I'm just very grateful, honestly. Like, even as you said, as we walked in today, I was thinking about like graduation. And I'm like, I'm coming out with so many people that I really love and I care about. And I'm so grateful that I was able to meet them through this work. So also, one thing that I would highlight is when you work towards something or you put yourself in areas that you enjoy, you naturally find people that you align with easier, that you might have common goals, you might have common, just ways that you think about life and what you want to do with your life. And I think that seamlessly interconnects people together. So that was something good as well.
Absolutely. Yeah. Pursuing your passion, and then the people you love will follow. Absolutely. I agree. And I think we just built a lot of trust as well, just naturally. And again, like Haya says, it makes the work a lot easier. I trust that she does her job correctly and efficiently, and she trusts that I do my job accurately as well. And it just makes for an easier road ahead for the entire year we've served on this e-board. And we've had a lot of issues and we've had a lot of rocky roads, but at the end of the day, we overcame it all and we did it together with everyone else on e-board as well, Alex and Penny. And it's just provided a great community.
So it seems like everyone's fallen in love with a problem together.
Yeah.
And you all are enjoying that process. It's ups and downs, really. Like the world is that people are choosing when they join a program like this. I'd love for both of you to highlight some of your favorite projects or partnerships you've had at AGPHI or even at GPH that you might have worked on together or even individually as an organization.
So I mentioned briefly the MENA project, and then actually it ended up becoming the modules that we created became a course certificate at the American University of Cyprus. So that was very exciting.
How did that happen? So a university picked it up, or?
Yeah, so the organization that we worked with, GHTE, they actually, they work globally in general, and they connected with the University of Cyprus. And I think just because of the gap that is there, kind of in the Mediterranean, towards public health, towards kind of going towards population health rather than individualized. So they picked it up, they really liked it, and we actually did a workshop, and it was very interesting, and I'm very proud of it. And other than that, the first project that I joined this lab with was the AGPHI project. It was on a medical supply chain project when we worked with this organization that redirects medical supplies to 80 plus countries. And they're usually supplies that are not being used or they would have been thrown out. So it's things that just basically going full circle and taking things and giving them back. And I really enjoyed it because, again, it was applied experience, and I was able to actually go to their unit up in Yonkers with one of their project managers from last year, and it was being able to meet a company and they just being able to work and create deliverables, lead the project at the time. And I think being able to just work with different areas, learn, be a listener, all these things. And I really enjoyed working with the teams as well. So I think that was my first step into public health, so it'll always have a soft spot for me. But yeah, so we have a lot of amazing projects, but these are some that came to mind right away.
Yeah, I agree with Haya. I think the MENA region project was a very big accomplishment this year for all of us, starting out how it did, and we've just built it into something so great and successful that the university in Cyprus wants to use the modules for, their students. Very similarly, as I've stated, the health literacy modules that we created for PAHO, targeting the adolescents and the youth on vaccine hesitancy and trying to overcome misinformation. And in the public health world, again, social media is very loud and broad and utilized, and not all the information on there is very true, relevant, or accurate. So really just giving them the tools to protect their communities and understand what is true, what is not, and how vaccines work, and just health in general, and giving them that education.
You both are superstar individuals, really, and I bet you both aren't even scratching the surface of all the projects you see on a regular basis.
Yeah.
So I'm curious, I want you to go back where we started this interview, both of you, where the day one person that came to join GPH, because at the time we're recording this video, you both are going to be graduating, and probably when someone's watching this, you both will no longer be at GPH, but a piece of you will always be here. So as you leave and as you come in, what was the person that came in at GPH on day one? You were moving from undergrad to grad school. You were coming from Lebanon. And who's the person right now? So what's next in your journey as you've had AGPHI skills, amazing professors, friendships, family? I'd love to hear that from both of you.
I'm very grateful overall for these past 2 years and the professional development that I've had, for everything that I've learned. But I think I have more trust in myself. I have more trust in my abilities. I think coming straight from undergrad, I was a little nervous and felt overwhelmed and a little intimidated by the fact that I didn't have the work experience or that a lot of other students had. They leave school and then they go work and they come back and they pursue a master's and they have a real world experience that they bring into the classrooms. And that is something that I developed not only through the lab, but, working in my APE, working in Zambia, and really just trying to pursue public health for me and understanding what that looks like for myself. So I'm very excited for the next chapter. I'm not too sure what it brings, but I think GPH has opened my mind up to so many different aspects of public health, not only epidemiology and, the behind the scenes of public administration, but I think the world is so vast and so broad, and public health is in everything that we do, everywhere that we go. And I think I really want to build on those intersectionalities and really just define, not only for myself, but for others, what public health means.
I love the confidence and self-assurance that's also come that you can even say something like that out loud.
Thank you.
Nice job. Yeah, love it. What about you, Haya?
Yeah, I think this actually was a very big turning point for me in my career life and my life in general, because when I was in undergrad, I was working in the hospital and everything, and I had this sense of feeling like my hands were tied, and I felt like I couldn't do a lot of the things that I wanted to do and help in the different ways that I wanted to help. So coming to this program, I was actually in a different concentration. I was in community health, and I changed to global health. I was still trying to put my foot down and get some reassurance that this is actually the right thing that I was supposed to be doing. And after a year and a half of just being in the program, and now nearly 2 years, I think I can very confidently say that this was the best decision of my life. Honestly, I feel like my hands are so filled with opportunities and being able to, there are so many different ways that I'm able to help and just work in this field. And I'm extremely excited as well to what's to come, and I'm very, very proud of just being able to have worked with so many different people on so many projects that I'm very passionate about. I'm using very a lot because this was actually such a big change for me, and I'm just glad that it went the way that it did and got the things that I did out of this master's, which was basically the opportunities, the work, learning about what I like, what I don't like. And I think when we start things, we were very scared of saying, I don't know, because that was something that I felt a lot when I first came to the program where professors would ask me, what specific thing do you want to work in or whatever. And I think we should be more accepting of that within ourselves, and just because that allows us to open so many different doors. And I think that's what got me to where I am today. And
there seems to be a common theme of trust with yourself, owning who you are, that GPH has given you kind of an identity for the next step of who you are. For the students out there that might be in their degree right now, might be applying maybe, or even the 12-year-old that's watching this and is thinking about coming to NYU, what is the one thing that a degree in GPH could give them? Let's leave it to a word or two.
I think it's something that we've been saying, definitely community-based. I think that is something that NYU GPH has done a phenomenal job at. I know that I've met other students in other master's programs, and I don't think that they've had such a sense of community within their programs, or have had other students to rely on or faculty members. But that is something that GPH definitely has done such a well-rounded job of, making sure that we have access not only to each other, but to alumni and to the faculty to address any of our concerns, to take on our ideas, and to really just encourage and emphasize the importance of working together, because at the end of the day, that is what public health is all about.
Couldn't hold it to 2 words, but that's what GPH is.
Sorry.
That's awesome though. I love it. You're not restricted to 2 words.
Yeah.
I'm just kidding.
I think for me, it's probably the 2 words that would pop in my mind are impact and connections.
Similar, yeah.
I could elaborate.
No, please go ahead.
So I think for connections, for sure, as you mentioned, we connect with so many professors, and it is up to the student also to go up to them and be proactive, but they will also give resources back and different projects to work on. And also impact in the sense that they don't just tell you to go read a book or just work on a research paper. They tell you to go out into the field, join this, join that, work on this project, or similarly to what we talked about, like the applied global public health. Like, we focus so much on working with people rather than just getting a paper out, or both are very important, but I think that's just a lot of the focus that I've seen, which is impact.
Well, folks, usually we have episodes that come from the mind with information. I feel like this episode came from the heart. The 2 of you, I wish you all the best in the next step of your journey. And thank you for sharing everything you got from this program. Really, I'm sure a lot of people are inspired listening to it. And thank you for being the superstars you are.
Thank you. Thank you so much.
Thank you for having me.
Yeah.
That's Haya and Nene, everyone. We'll put everything about AGPHI in the description. And we'll see you in the next one. Take care.
Bye.